Buenas tardes, gracias por...
Good afternoon, and thank you very much for the invitation. I'd like to move on to my first slide to look into the challenges that we have in terms of nutrition. We're all here today because we have bad dietary habits, and in most cases, this can worsen our health. And this is why we need to look into it, because it can put our health in risk, and it has a heavier weight than other factors. I would like to look into 3 levels: the personal level, the population level, and the global level, or the planetary nutrition, especially in the way it affects the globe and the way we make certain decisions. I would like to start with the personalized nutrition. This slide, thank you. This can be analyzed from different perspectives. We can have different groups of people. We'll have people that have hypertension, high cholesterol, obesity, and the general tendency is pointing to personalized nutrition or precise nutrition. Next slide. And so in this context, we see that certain people have allergies, intolerances, metabolic diseases that find themselves in different stages in their life regarding their age, whether a person is pregnant, lactation, and then we also have the cultural factors. All of these are essential when defining the different factors. We're talking about people, not just a population group. We decided to dwell onto genetics and non-genetic factors and the way in which certain genes, we take food in different ways. The effects of food can be different. The perfect example is coffee. Some people can have a coffee all day, including at midnight, and they'll be able to sleep perfectly, whereas others can't. So all of this has to be taken into account in the decisions that we take. We can have certain people that have certain genes, such as the ones that you see on the slide, that need to take zinc supplements in order to have maintain glucose homeostasis, so an equilibrium in their glucose. Mediterranean diet can also reduce stroke risk in some cases. And we also have people that have to take vitamin B2 to reduce the risk of hypertension. Next slide, thank you. This has to be taken into account. There was the study that was funded by the EU, Food for Me, that also detected that personalized nutrition would be optimal. Instead of general recommendations, we don't have one size that fits all, and we cannot apply that principle to everyone. With the tools that we have at our availability, including artificial intelligence, we can look into the diet, the microbiome of an individual, the doctor's reports, physical activity, the different tools that we have to measure our health, wearable sensors, for instance. If all of these factors are included in an artificial intelligence program, we would have individualized recommendations for every citizen. And that is something that we're looking into. We have this recent study of the American Health Association that enabled us to establish 6 million genetic variants, and we had different scores according to the different types of genes. Those that had certain genes had a higher risk of suffering cardiovascular diseases. But on the next slide, we can have life's simple 7.
Sí, con estos 7 consejos de vida.
With these simple 7 tips: stop smoking, eating better, losing weight, being active, reducing blood sugar, and managing blood pressure. With these 7 different tips, we would be able to attain a lot more than when analyzing our genes. Personalized diets are still important, but general advice must not be forgotten. I would like to look into the Mediterranean diet. We know that it is number one in comparison to many others. This is something that we've been studying for years. This is the US News that it was better than the DASH diet and the flexitarian diet that were good against hypertension. And in Spain, we decided to carry out this study, PREDIMEDS, that looked into the effects of the Mediterranean diet on cardiovascular diseases. We had groups of people that had high cardiovascular risks, and so we just divided them into different groups. Some of them followed a Mediterranean diet with virgin olive oil, others with nuts, and then a third control group that had a low-fat diet. So we were looking into diets that were high in vegetable fats and lower vegetable fats. Not all fats are bad, as many say. We can have dried fruits or olive oil that are really good for our health. And so with this study, we had randomized groups that gave us a high level of scientific evidence, and we were able to detect that those that were that had the extra virgin olive oil Mediterranean diet and the Mediterranean diet with nuts had 50 less probabilities of suffering these diseases and dying from them. We were able to reduce the mortality rates. And so when looking into the different numbers, the effect was of 60%. There is no medicine that has such a high impact in preventing cardiovascular diseases as the Mediterranean diet. And so this was applicable to all groups, both male and female, all age groups, and diabetics and non-diabetics. So it was efficient whenever it was followed in the right manner. And something that was very interesting is that when we were looking into the polymorphism factors, we were able to detect that those that weren't following the Mediterranean diet properly, if someone had a polymorphism, they would have a very high higher glucose. And the situation could be improved with the Mediterranean diet. So we were able to block the bad genes. So the environments can have a very strong impact in the genes, and it can really work on certain gene groups that a person may present. This also had an influence in the strokes, so that had these polymorphisms, TT and CT, had more prevalence of ictus. But when following the Mediterranean diet, all polymorphism groups were able to lower the quantity or the possibility of suffering a stroke. Another thing that I would like to underline is sustainability, because we have no planet B. Sustainability is essential whenever making decisions. And so we cannot follow certain advice if the actions are not respecting the environment and are not sustainable. And so in this regard, red meats, has a very negative impact on the environment, also because of the water consumption, especially not to suppress it completely, just to reduce the red meat consumption. So the flexitarian diet, that is very similar to the Mediterranean diet that has a lot of vegetables, would be highly recommendable for our population. We believe that flexitarian diet is better than the vegetarian because of B12 and other vitamins. There is no better diet than the Mediterranean one. And so our advice is to reduce the consumption of meats, starchy vegetables, so potatoes, sweet potatoes, and increase the number of whole grains, fruits, vegetables, so that our diet can be truly healthy. And so with this, I'd like to conclude. Personalized nutrition is the future. Of course, we still need to work and we need further studies. The Mediterranean diet is the best offer because we've been able to scientifically prove that it prevents cardiovascular disease, diabetes, neurodegenerative diseases, and cancer. And when making decisions, we need to preserve the health of the planet. So the best diet for a person is usually the best diet for population and for the planet. And in this case, it would be the Mediterranean diet. Thank you very much.